Hi, I'm Dr. Agan. Has this ever happened to you? You start with a sniffle or cough, but then when you call to see your doctor, you find out she's booked up for weeks. You could go to the ER, this really is an emergency, or you could go in urgent care, but this isn't that serious, and either of those visits can be costly. So, more often than not, you wind up like our friend. Ugh, whatever. If I still feel like this tomorrow, I'll make an appointment. Uh-oh. Gross. What if I told you there was a way that, without even leaving your home, you could see a doctor within 90 seconds? And what if that visit cost you just $4? You'd do it, right? Of course, you'd have to change your pants first. Introducing Doctor on Demand. Doctor on Demand is a mobile app that allows you to video chat with a board-certified physician in your state with the touch of a finger. You simply describe what's going on, select your symptoms, give your history and your medications, and start your visit. During your video chat, your doctor may ask you to perform some physical exams on camera. Things like shining a light down your throat, filling your lymph nodes, or taking your temperature. Doctor on Demand treats adults and kids and has mental health professionals for those needs too. While there are limitations, Doctor on Demand can treat a wide array of ailments that used to require being seen in person. They can send prescriptions to the pharmacy electronically, and your medical records are easy to access and send to where you need. Visits are just $49 each, but your insurance may cover most of the costs like mine does. Meet Amy, a hardworking mother who has lots of questions about her daughter's health, but who can't afford to take a whole afternoon off of work to see the doctor. Luckily for little Artemis here, the future of medicine has arrived. Hey guys, this is Riley now. Doctors on Demand is the largest provider of a service we call telemedicine. I've used them as an example, but would like to speak more broadly now about the telemedicine industry. Dr. Agan wasn't exaggerating earlier. The average wait time to see a doc in the U.S. is 3 weeks. In fact, the American Academy of Family Physicians estimates a shortage of 90,000 family docs by 2025. That's the entire population of Lawrence. Like with Amy, a short doctor visit can end up taking hours. Even the average ER visit is over 2 hours. These visits are expensive to the patient, the insurer, and the hospital. Yet, because of shortages, ER visits have more than doubled in the last 2 decades. With telemed innovations like Doctors on Demand, problems can be addressed earlier, keeping acute episodes from sending you to the ER. It also addresses lesser problems that shouldn't be in the ER in the first place. This saves everyone money, gets you back to health faster, and allows emergency rooms to move faster and deliver better care by not being spread so thin. Thumbs up. In fact, Doctors on Demand is available 24/7 and treats 92% of patients remotely without the need for further workup. This is the value offered by telemedicine, and everyone gets to benefit. Telemed is hardly a new field. However, with the advent of high-quality cameras, the market is growing and the game is rapidly changing, passing new milestones before they're even set. Teladoc, a Dallas-based telemed company, has doubled their encounter since 2013, and market analysts estimate the U.S. market will grow from $240 million in 2014 to $2.2 billion by 2018. In fact, Kaiser Permanente, the largest managed care organization in the U.S., reported that over half of their 110 million patient-doctor interactions in 2015 took place via smartphone, video conference, or some other technical platform. So what's being disrupted? In this case, that might be a bit of a misnomer. As I've shown, the telemed market is rapidly growing, but doctors are still over capacity and ER visits continue to rise. Still, though it improves costs and care, telemedicine will undoubtedly cut into revenues, mostly for ERs and urgent care clinics. There is also a new breed of family docs whose value proposition is 24/7 access to their personal cell phone. This could spell bad news for those guys too. It's also important to highlight the limits of telemed's capabilities. It isn't poised to destroy our healthcare system and can't replace a physician who's known you for years. However, it may greatly disrupt when and through what channels patients enter our healthcare system in the future. I think of this more as creative harmonization. However, not everyone sees it that way. Like with most disruptive innovations, legal restrictions are being put forth by industry incumbents around the nation. In some instances, there is earnest concern about the quality of care that can be delivered remotely, but other examples are more obviously rent-seeking. For example, the Texas Medical Board recently voted that in-person clinical relationship must be established before patients can be diagnosed or prescribed drugs electronically. In addition, questions can't even be answered through email, electronic text, or telephone. That being said, many doctors support the growth of telemed. Many states are loosening restrictions and requiring insurers to pay for the services. Lobbying groups of politicians, health and tech giants are offering their support. At least 5 bills designed to further its use have bipartisan support in Congress. In conclusion, I'd like to point out that in recent years, the healthcare system has been designed around doctors and other providers, asking patients to come to their place of business for their services. In 2017, new technology means this inconvenience isn't always necessary. Telemed innovations like Doctor on Demand hope to disrupt this old way of thinking by bringing more affordable and more accessible health care to the palm of your hand while securing better care for everyone in the process.